Greetings everyone. For today's lecture, we're going to learn more about the fundamentals of nursing. Unit 1, the nature of nursing. Chapter 1, historical and contemporary nursing practice. And for today's lecture, we're going to focus on factors influencing contemporary nursing practice. This book from Kusher and Herb will be our main reference. To understand nursing as it is practiced today and as it will be practiced tomorrow requires an understanding of some of the social forces currently influencing this profession. These forces usually affect the entire healthcare system, and nursing, as a major component of that system, cannot avoid the effects. So here I have a set of pictures that shows the factors affecting contemporary nursing practice. So you can see here a woman, a single woman, and you see here a group of persons or a family, a beaker, a person working on a laptop, an equipment that is used by a judge in a court ruling, a chart with people on it, a shovel, a hospital, a warning sign, a nursing cap with a downward logo and an upward logo here. So let's connect these on the different factors affecting contemporary nursing practice. So what does this stands for? First, consumer demands. The group of people stands for family structure. The beaker stands for science and technology. The woman working on a laptop stands for information, telehealth, and telenursing. The equipment used by a judge stands for legislation. The pie chart with a group of people on it for demography. A shovel for collective bargaining. A hospital for healthcare reform. A warning sign for quality and safety in healthcare. A cap with a downward sign for nursing shortage, and a cap for an upward sign for nursing associations. So these are the 11 factors influencing contemporary nursing practice, and we're going to define each of these. First is a consumer demands. Consumers of nursing services, aka the public, have become an increasingly effective force in changing nursing practice. On the whole, people are better educated and have more knowledge about health and illness than in the past. Consumers also have become more aware of others' needs for care. The ethical and moral issues raised by poverty and neglect have made people more vocal about the needs of minority groups and the poor. The public's concepts of health and nursing have also changed. Most now believe that health is a right of all people, not just a privilege of the rich. The media emphasize the message that individuals must assume responsibility for their own health by obtaining a physical examination regularly, checking for the 7 danger signals of cancer, and maintaining their mental well-being by balancing work and recreation. Interest in health and nursing services is therefore greater than ever. Furthermore, many people now want more freedom from disease. They want energy, vitality, and a feeling of wellness. Increasingly, the consumer has become an active participant in making decisions about health and nursing care. Planning committees concerned with providing nursing services to a community usually have active consumer membership. Recognizing the legitimacy of public input, many state nursing associations and regulatory agencies have consumer representatives on their governing boards. Secondly, are family structure. New family structures are influencing the need for and provision of nursing services. More people are living away from the extended family and the nuclear family, and the family breadwinner is no longer necessarily the husband. Today, many single men and women rear children, and in many two-parent families, both parents work. It is also common for young parents to live at great distances from their own parents. These young families need support services such as daycare centers. Adolescent mothers also need specialized nursing services, both while they are pregnant and after their babies are born. These young mothers usually have the normal needs of teenagers as well as those of new mothers. Many teenage mothers are raising their children alone with little, if any, assistance from the child's father. This type of single-parent family is especially vulnerable because motherhood compounds the difficulties of adolescence. Also, because many of these families live in poverty, the children often do not receive preventive immunizations and are at increased risk for nutritional and other health problems. Third factor is science and technology. Advances in science and technology affect nursing practice. For example, people with AIDS or acquired immunodeficiency syndrome are receiving new drug therapies to prolong life and delay the onset of AIDS-associated diseases. Nurses must be knowledgeable about the action of such drugs and the needs of clients receiving them. Biotechnology is affecting healthcare. For example, nurses are exposed to emerging genetic technology, such as the field of cancer gene therapy. Nurses will need to expand their knowledge base and technical skills as they adapt to meet the new needs of clients. In some settings, technological advances have required that nurses be highly specialized. Nurses frequently have to use sophisticated computerized equipment to monitor or treat clients. As technologies change, nursing education changes, and nurses require increasing education to provide effective, safe nursing practice. The space program has developed advanced technologies for space travel based on the need for long distance monitoring of astronauts and spacecraft, lighter materials, and miniaturization of equipment. Healthcare has benefited as this new technology has been adapted in such healthcare aids such as ViewStar, an aid for people with visual impairments, the insulin infusion pump, the voice-controlled wheelchair, magnetic resonance imaging, laser surgery, filtering devices for IV fluid control devices, and monitoring systems for intensive care. Fourth are the information, telehealth, and telenursing, especially true during this pandemic. The internet has already affected healthcare, with more and more clients becoming well informed about their health concerns. As a result, nurses may need to interpret internet sources as information for clients and their families, because not all of the internet based information is accurate. Nurses need to become information brokers so they can help people to access high quality, valid websites, interpret the information, and then help clients evaluate the information and determine if it is useful to them. The prefix tele means distance and is used to describe the many healthcare services provided via technology. Telehealth is the use of medical information exchanged from one site to another via electronic communications to improve the patient's health status. The words telemedicine and telehealth are often used interchangeably. Telemedicine is often associated with direct line clinical services, whereas telehealth has a broader definition of remote healthcare services. Telenursing is the use of telecommunications and information technology to provide nursing practice at a distance. The delivery of telehealth care, however, is not limited to physicians and nurses. It includes other health disciplines such as radiology, pathology, and pharmacology. These disciplines also deliver care using electronic information and telecommunications technologies. Nurses engaged in telenursing practice continue to use the nursing process to provide care to clients, but they do so using technologies such as the internet, computers, telephones, video teleconferencing, and telemonitoring equipment. Telenursing continues to grow, especially in home healthcare and in rural communities. Telehealth recognizes no state boundaries, and subsequently, licensure issues have been raised. For example, if a nurse licensed in one state provides health information to a client in another state, does the nurse need to maintain licensure in both states? The NCSBN, or the National Council of State Boards of Nursing, endorses a change from single state licensure to a mutual recognition model. Many state legislatures have adopted mutual recognition language into statutes and are currently implementing it. Next is the legislation. Legislation about nursing practice and health matters affects both the public and nursing. Legislation related to nursing is discussed more in Chapter 4. Changes in legislation relating to health also affect nursing. For example, the Patient Self-Determination Act, or the PSDA, requires that every competent adult be informed in writing on admission to a healthcare institution about his or her rights to accept or refuse medical care and to use advance directives. This is very important before you admit a patient. They must know their rights to accept or refuse medical care. Healthcare reform and the shortage of physicians calls for an increase in advanced practice registered nurses, such as nurse practitioners. Currently, there are wide variations in state regulation of nurse practitioner practice. For example, 27 states do not require physician oversight of a nurse practitioner's practice. However, 16 states still require NPs to practice under severe restrictions. As a result, NPs cannot easily move from state to state, which decreases access to care for clients. In 2008, 48 professional organizations, including the NCSBN, developed a consensus model that provides guidance for states to adopt uniformity in the regulation of advanced practice registered nurses. Many states have adopted portions of the model elements, but variations remain from state to state. You can learn more about this on their website. Sixth factor is a demography. Demography is a study of population, including statistics about distribution by age and place of residence, mortality or death, and morbidity or incidence of disease. From demographic data, the needs of the population for nursing services can be accessed. For example, the total population in North America is increasing, The proportion of older adults has also increased, creating an increased need for nursing services for this group. Second, the population is shifting from rural to urban settings. This shift signals an increased need for nursing related to problems caused by pollution and by the effects of the environment or concentrations of people. Thus, most nursing services are not provided in urban settings. And thirdly, mortality and morbidity studies reveal the presence of risk factors. Many of these risk factors, such as smoking, are major causes of death and disease that can be prevented through changes in lifestyle. Next factor is collective bargaining. More nurses are using collective bargaining to deal with their concerns. The ANA participates in collective bargaining on behalf of nurses through its economic and general welfare programs. Today, some nurses are joining other labor organizations that represent them at the bargaining table. Nurses have gone on strike over economic concerns and over issues about safe care for clients and safety for themselves. The eighth factor focuses on healthcare reform. With the passage of the Affordable Care Act or ACA in 2010, healthcare reform was on a fast track. Transformation in healthcare delivery and financing systems accelerated in 2014 when major provisions of the legislation were implemented. Healthcare delivery's focus has shifted from acute care to primary preventive care and treatment of chronic conditions using healthcare teams and information technology. Also in 2010, an IOM report or Institute of Medicine report entitled The Future of Nursing, Leading Change, Advancing Health, provided recommendations on what nursing needed to do to provide better client care in the new systems that will be part of health reform. This report identified four key areas: nurses practicing to the fullest extent of their skills and knowledge, nurses achieving higher levels of education, nurses being full partners with physicians and other healthcare professionals, and improving data collection and information infrastructure. Ninth factor is the quality and safety in healthcare. Quality and safety are inherent universal values on which healthcare is based. However, the report To Err is Human, published by the Institute of Medicine in 2000, revealed a gap between the status of American healthcare and the quality Americans should receive. Since then, the IOM has published a series of reports confirming that quality and safety are the leading contemporary issues in healthcare, contributing to cost and poor outcomes. The 2003 IOM report entitled Health Professionals Education, A Bridge to Quality called for a redesign of the education for healthcare professions and described six core competencies needed to improve 21st century healthcare. This includes patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. You can remember it by the acronym QSPITE. And in 2005, the Robert Wood Johnson Foundation funded a project called Quality and Safety Education for Nurses, or the QSEN, and its goal was to meet the challenge of preparing the future nurses who will have the knowledge, skills, and attitudes, or KSAs, necessary to continuously improve the quality and safety of the healthcare systems within which they work. This project used the IOM6 competencies along with the knowledge and experiences of recent faculty and a national advisory board to define quality and safety competencies for nursing. The project also proposed KSAs for each competency that could be used as guides for curriculum development in pre-licensure nursing programs. So this is the website where you can access this. And I'll give you here their definitions. Okay, starting from patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. So these are the definitions of core competencies according to their website. Patient-centered care recognizes the patient or the assignee as a source of control and full partner in providing compassionate and coordinated care based on respect for patients' preferences, values, and needs. So it says here that patients are the center of our care. They are the source of the data that we can work on to provide care that is more individualized and more focused on them. So we must respect their values, their preferences, and needs. We must not coerce them on what they wanted to do or wanted to have. Next is teamwork and collaboration. It functions effectively within nursing and interprofessional teams, fostering open communication, mutual respect, and shared decision-making to achieve quality patient care. Next is an evidence-based practice. It says here that it integrates best current evidence with clinical expertise and patient or family preferences and values for delivery of optimal healthcare. Next is quality improvement. Quality improvement uses data to monitor the outcomes of care processes and use improvement methods to design and test changes to continuously improve the quality and safety of healthcare systems. Next is safety. Safety minimizes risk of harm to patients and providers through both system effectiveness and individual performance. And lastly, informatics. Use information and technology to communicate, manage knowledge, mitigate error, and support decision making. Okay, you can use the acronym QSPI for this. And these are the complete table from their website, focusing on each core competencies and also the necessary KSAs or the knowledge, skills, and attitudes in order to achieve each of these core competencies. This is for patient-centered care. It is for teamwork and collaboration. This is for evidence-based practice. This is for quality improvement. This is for safety. And lastly, this is for the informatics. You can access this on their website and you can read each of this to understand them fully and more deeply. Now we go to the nursing shortage as another factor that influences contemporary nursing practice. Okay, registered nurses are the largest segment of the healthcare workforce. According to the Bureau of Labor Statistics in 2013, the number of employed RNs will grow from 2.7 million in 2012 to 3.2 million in 2022. This number increases by an additional 1.2 million when including replacements for nurses who leave or retire from the profession. Contrast that information with an AACN statement in 2012 with the American Association of Colleges of Nursing that the United States is projected to have a nursing shortage that is expected to intensify as baby boomers age and the need for healthcare grows. Factors for this prediction include the concurrent nursing faculty shortage, the increasing average age of RNs, and the increasing number of aging older adults along with their increasing healthcare needs. Whereas there is a projected shortage of nurses by 2022, whether or not there is a current nursing shortage depends on where the nurses live and where they are willing to work. The supply and demand of nurses is not uniform. For example, the RN shortage is projected to be the most intense in the South and the West according to AACN. Currently, new graduates are having difficulty finding that first job as a consequence of the declining U.S. economy. Because of economic pressures and job losses in all industries, many nurses increase their hours in order for retirement. Combined with lower hospital census, employers hiring new graduates with baccalaureate degree, many open RN positions requiring at least 2 years of experience, and the reputation of new graduates having a high turnover rate, many hospitals have stopped interviewing new graduates. The healthcare setting is another factor. The growth of RN positions will occur in community-based settings rather than acute care hospitals as an increasing proportion of the U.S. population has healthcare coverage through the Affordable Care Act. They also pointed out that many new graduates have unrealistic expectations, example, seeking only the day shift or working minimal weekends or only being available part-time. These types of demands will limit the graduate from getting a job, making flexibility for hours, shift, and unit key advantages. Together, the National League for Nursing and the National Student Nurses Association have published a brochure with helpful information and tips for the new graduate who is looking for a job. It says here, how can you prepare for a competitive job market? Let's see this closer. Okay, these are the following tips that can help prepare you to be successful in obtaining your first nursing position. First, attend the NSNA Career Planning Conference and Annual Convention before and after you graduate. Continue your education. If you have a diploma or associate degree, explore RN to BSN programs. If you have a BSN, explore MSN programs. Attend meetings of your alumni association. Include a cover letter when you submit your resume and application. Practice interviewing skills. Network with the nurses at healthcare agencies where you are completing your clinical practicum. Take the NCLEX RN as soon as possible after graduation. When you get an interview, smile and show you are excited about this opportunity. Join a professional nursing organization. Be open and flexible. Find an entry-level position that will give you work and professional growth experiences. Look outside of acute care settings for entry-level positions. Take a residency or internship if it is not in your interest area. Stay current through continuing education and consider completing certification opportunities. And make sure that your resume truly reflects your education, skills, and experience. As the economy improves, opportunities for new graduates should open up. One current solution to assist new graduates to transition into practice is nursing residency programs. Some of these residency programs are partnership between the acute care setting and a school of nursing, and others are programs within the acute care institution. Evidence shows that substantive orientation plans for mentoring, residency, and other formal transition to practice programs result in higher retention rates of the new graduates. Additionally, here are other factors and recommendations regarding nursing shortage. Factors include aging workforce, nursing faculty and population, decrease of entry of younger people in the nursing profession, increased nursing demands, and workplace issues. Here are some recommendations. We must develop mechanisms for nursing students to progress to and through educational programs such as the nurse residency programs. Recruit young people to nursing early. And I think most importantly, improve the work environment and increase the nursing education funding. Okay, the last factor influencing contemporary nursing practice are the nursing associations. Professional nursing associations have provided leadership that affects many areas of nursing. Voluntary accreditation of nursing education programs by the Accreditation Commission for Education in Nursing and Commission on Collegiate Nursing Education has also influenced nursing. The ACEN supports the interests of nursing education, nursing practice, and the public by providing specialized education for all levels of nursing education and transition to practice programs. As the leading authority in nursing education accreditation, the goal of the ACEN is to be a supportive partner in strengthening the quality of nursing education and transition to practice programs. Officially recognized by the U.S. Secretary of Education as a national accreditation agency, the CCNE is an autonomous accrediting agency contributing to the improvement of the public's health. It ensures the quality and integrity of baccalaureate and higher degrees such as graduate and residency or fellowship programs in nursing. It also serves the public interest by assessing and identifying programs that engage in effective educational practices. As a voluntary, self-regulatory process, CCNE accreditation supports and encourages continuing self-assessment by nursing programs and supports continuing growth and improvement of collegiate professional education and nurse residency or fellowship programs. Many nursing programs have steadily improved to meet the standards for accreditation over the years. As a result, nurse graduates are better prepared to meet the demands of society. To influence policymaking for healthcare, a group of professional nurses are organized formally to promote political action in the nursing and healthcare arenas. The NPA, or the Nurses for Political Action, formed in 1971 and became an arm of the ANA in 1974 when its name changed to Nurses Coalition for Action in Politics, or NCAP. In 1986, the name was changed to American Nurses Association Political Action Committee, or the ANA PAC. Through this group, nurses have lobbied actively for legislation affecting healthcare. A number of nursing leaders hold positions of authority in government. Attaining such positions is essential if nurses hope to exert ongoing political influence. Okay, so as a summary, we've discussed about the factors influencing contemporary nursing practice. And this illustration that I've shared, let's review. So the factors influencing contemporary practice are consumer demands, family structure, science and technology, telehealth or telenursing, legislation, demography, collective bargaining, healthcare reform, quality and safety in healthcare, nursing shortage, and nursing associations. And specifically, we discussed about in legislation the PSDA, or the Patient Self-Determination Act, in which we should discuss to every patient prior to their admission their rights to accept or refuse any medical care. Also, we've discussed about the consensus model, in which it regulates the uniformity in the practice of advanced practicing registered nurses. Also, in healthcare reform, we've discussed about the Affordable Care Act, in which the shift from acute care to primary preventive care. And we also discussed an IOM report entitled Future of Nursing, in which they provided some recommendations in order to improve better quality healthcare. And in quality and safety, we discussed about a report entitled To Err is Human, in which they discussed about the gap between the status of American healthcare and the status on the healthcare that is being received by the Americans. We also discussed about another IOM report entitled Bridge to Quality, in which they recommended that there should be a redesign in the healthcare delivery system, and they also provided 6 core competencies in which the 21st century healthcare should have, namely the QSPIDE, the quality improvement, safety, patient-centered care, informatics, teamwork and collaboration, and the evidence-based practice. Also under quality is the QSIN, or the Quality and Safety Education in Nurses, that is funded by the Robert Wood Foundation And it also emphasizes the need of Q-Spike with the addition of the knowledge, skills, and attitudes needed for every healthcare professional. Then in nursing shortage, we discussed about some of the factors and recommendations in order to improve the population of nurses in our current healthcare delivery. Also discussed about nursing associations, some of the voluntary accreditation commission are ACEN, Accreditation Commission for Education in Nursing, which accredits all levels of education in nursing, and the CCNE are Commission on Collegiate Nursing Education, in which they accredit more on the baccalaureate degree and higher, such as in masteral doctorate degree as well. And the ANAPAC, or the American Nurses Association Political Act Committee, in which they lobby the Congress in order to provide and also improve legislation in for the healthcare. And next, we're going to discuss about the nursing organizations. Thanks for watching.